All right, good afternoon to everyone, and welcome to the Care360 sponsored webinar, Improve Your Bottom Line by Reducing Claims Denials. My name is Colby Dix, and I will serve as your moderator and host today. Today's agenda is simple enough. We're going to dive right into Mark's presentation shortly, and there will be a brief Q&A directly following. Please also stay with us for a brief overview of Care360's complete suite of healthcare IT solutions. Quick bit of housekeeping. Please do feel free to use the built-in WebEx Q&A box to submit any questions during the seminar, and we will do our best to get to all of them in the time allotted. If for any reason we don't have sufficient time, rest assured that either Mark or a Care360 representative will answer you directly offline. I'd like to extend a warm welcome to our presenter today, Mark Anderson. Mark's bio is up on the screen now, and you can see that we're truly very lucky to have someone with such experience available to us. His 40-plus years dedication to healthcare IT and consulting has earned him great renown in our industry. Now, welcome, Mark Anderson.
Well, thanks for inviting me. Can you hear me okay?
Yeah, it sounds great. Thanks.
Good. All right. Perfect. Well, this should be a good session today because I know every practice out there has questions and issues about denials that come into the insurance plans. And we'll talk a little bit about rejected claims, but mostly about denials because that is one of the biggest focuses on what is costing doctors a lot of money today and how do we find better ways of handling denials as we go forward.
Excellent, yeah. And today's webinar is going to follow a question-answer style format, and I'll be asking the questions that you see on the screen here of Mark, and he'll, of course, provide the answers and the insight that we hope is quite useful to you all. So as he said, today's topic being denials, we know it's a major concern really to the strong majority of active practices today. But before we do go in for the deep dive, Mark, if you don't mind, if you could give us an overview of denial management and really how that affects practices today.
Well, if you think about what a denial is, this is when you actually have a properly formatted patient claim that gets sent to the insurance plan. The insurance plan receives it, says, yes, this is one of our patients, but rejects it for a number of reasons. There's over 350 different denial codes. But the main thing is these are good, clean claims that went out of your EHR through your practice management system to them. But they have determined that for whatever reason, the patient, they're not going to pay the claim. They're just denying it outright. And you have to look at that denial, fix the denial relatively quickly, or you will not be able to get paid for that services, and you have a limited amount of time to do it. And if you're getting 10, 15, 20 denials within a week, you got to make sure you've got staff set aside to be able to work those denials and get them taken care of in a real fast amount of time. Otherwise, you're not going to get paid for it. So it's one of those things where you almost have to create a process around each type of denial, because each type of denial has a different process for fixing the problem. So let's talk about, some of the areas where there are really major issues with the denials. And in the beginning, a lot of the problems relate to your registration system, because a lot of times practices will register a patient, they will see the patient, they will treat the patient, and they'll send a claim out. You don't even know if that patient's eligible yet. So you have to do making sure you're going through and checking the patient's eligibility ahead of time. Because if you don't, again, you could have a variation in the number of denials from 8% of all your claims up to 35%, which is what we're seeing out there. And you think about what is the cost to handle the denial. The average practice staff adds up to $1,000 a time working denials, make sure they're done correctly. You only got 30 to 90 to handle each one of those denials. You have to create a much better program. And my kind of program I like is let's find ways of eliminating the denials, not just working them. You can spend a lot of time working 50 or 60 denials, but wouldn't you rather delete or eliminate 40 denials before they actually occur? That's what a true denials management program is. It helps you delete and eliminate the denials before they occur versus just handling a denial. And that's what we're kind of talking about today is how do we work through that whole process. Let's go to the next screen. So let's just think about something. Let's just assume your practice is making about $100,000 per month, and your denial rate is 18%, which is kind of like the national average for a lot of these things. And let's assume that 55% of your denials are for reasons that cannot be appealed. Things like patients not covered, timely filing, no authorization code was there, that the diagnostic code really doesn't match certain things. So they're going to deny these claims, things that you could have caught up front. And let's just assume that your practice is late on refiling some of these denials. And again, the national average is about 29% of denials are filed late. This could equate to about $153,000 per year of lost revenue for a practice that's doing $100,000 a month in actual claims. You have to really figure a way of working these things, not just figuring out what the problem is and fixing it, but finding a way of eliminating the denial before it actually occurs. And there's multiple processes we'll talk about today on how you can do that. So let's talk about two different types of revenue cycle and denial management software. The common one, and this is the one that's in every single practice management system today. It basically allows you to identify that you had a denial because the insurance company sends you an information that says it's denial. You can pull up that denial, you see the code, you can go work the denial. Hopefully the patient is eligible, and you can resubmit the information in later. You can handle those one by one. What we're looking for going forward is what I call enhanced revenue cycle management software. This is the ability to track the number of denials by denial reason by insurance carrier. So you can look at that over time. Are you getting more denials from Aetna than from Cigna than from somebody else? And where are those denials? What is the code? It allows you to go in, find what the denial reason is, correct that denial reason, and then resubmit all of the claims that have that same reason code. For an example, we had one practice where the physician did not have their state certification yet, but was still treating the patients. They were sending the claims out, and they should not have because they did not have the right ID number yet. Once they got the right ID number, the common way would go back in and you change every single claim one by one until you got all of the claims updated with the correct information. With enhanced denial management programs, you go in and correct it once. The software figures out all of the claims that related to that same insurance plan with that same denial reason and corrects all of them. Like I say, why correct one by one? We could correct it once and all of the claims related to that get corrected at one time. And again, the ability to track why there's denials out there over time by insurance plan, by denial reason, helps you figure out where your problems are, and you can go in and change some of the software on the practice management side to eliminate those denials, changing business rules. You don't let a claim go out without certain things on it, making it more of not only a clean claim, but a claim that will be automatically adjudicated. And that's what we really have to do as we move towards advanced claims denial programs. And it's interesting, if you look at what's been going on, the number of denials by year has been going up. And for the common system, again, we were around 15%. We're seeing up to 20% now for a lot of these denials, just like regular denials. But under people that are under enhanced denial programs, which really kind of kicked in around 2016 when the products got a little bit better, we're actually seeing a decrease in the denials. They're still out there, but we can find ways of cutting it back so you don't have as many denials going forward. Why work a whole bunch of things when you can eliminate denials from the front end? And that's why these enhanced revenue cycle denial management programs can make a big difference out there for a practice, especially around their annual reimbursement. Don't lose money, make the money as you're going. These are our practices that are doing over $100,000 per month in revenue. Typically, it's a 2 or 3 doctor practice, depending on your size, obviously. But with the common denial, you start looking at the cost as it's been going up. You can be talking about $22,000 a month in lost revenue because you're not handling the denials correctly. Under these enhanced programs, it's starting to really come down, and you're seeing a gap now. So why lose potentially $22,000 when we can drop it down to $14,000? Not a lot, but that could be $8,000 a month for your practice, for a physician, just by getting rid of the reason for the denials, by managing the denials, working the denials, but having an enhanced denial management program. And we're going to get into more of the details a little bit later.
So you would definitely consider the increased usage of managed billing services to have a direct correlation to that decrease in rejected claims?
Yes, we do, because we're finding with the managed services out there, they know all the business rules. And the typical software product now has 800 business rules in there just so that the claim goes out correctly and doesn't get denied. Obviously, doing upfront claims or eligibility checking for the patient, checking the patient's eligibility when they check in, but having all the additional things to make sure that claim goes out correctly. There's no rejections, and that it's automatically checking for whatever potential denials out there before you submit it. You're better off having somebody look at it, fix it, and get that there is no denial versus sending it out, and then you're just adding on additional steps to everything. So we really got to find a way of getting these billing services and your software, your practice management software, a lot of times we're calling it revenue cycle management now, with the ability to check these things. Reduce the number of rejections up front and reduce the number of denials. Because, again, the cost for handling denial is a lot more once you send it in. If you can fix it up front, you're going to do a lot better. And, again, remember, the biggest problem with denials is timely filing. Getting that claim in correctly, and then if the claim does get denied, how do you fix it fast enough so you're able to improve the overall collection rate of the organization?
So a lot of times we kind of lump it together when we're talking about rejections and denials. And I know you've already touched on it to some degree, but if you don't mind explaining more discrete differences between a denial and a rejection for us.
Let's start with the rejections and talk about what those really are. So there's a lot of things that go on where the claim does not meet the specific data requirements or the basic format necessary to send in a claim, and it gets rejected. Pieces of information is missing. The patient ID number is not the right length. The date of service is after the date of billing. There's little things like that, which is amazing how many claims get rejected because they didn't meet the requirements of just submitting the claim in normally. And again, with more advanced practice management systems over the years, we have been able to reduce the reason for rejections down. But simply, it's a claim that gets rejected because the submission was not done correctly. And the challenge is, of course, if you don't submit it correctly, the patient's not really liable for that because you never submitted the bill to the insurance plan. And that's how they look at it. We never received it. We didn't reject it. We didn't pay it. Or we didn't pen the claim because we needed more information. We never received it because the format was not correct. And literally a number of years ago, we had a lot more of those kind of rejections compared to denials. Now let's talk about denials themselves. The next slide. This basically is a claim that has been received by the insurance plan. It has gone through their adjudication process, but for whatever reason, the healthcare plan has decided they are not going to pay this claim, that they have decided they're going to deny it for whatever reason. As I mentioned, there's about 350 denial reasons. And again, a claim that gets denied cannot be appealed because the payer has not received the right information and said it's no longer valid. Now, once you correct it and they no longer deny it, then you can appeal it. But it's very hard to appeal a denial unless you have actually corrected it and sent it back in. So think of a rejection as it rejected from the computer system and the healthcare plan never received it, versus a denial, they received the claim, but for one of the 350 denial reasons, they denied the claim and they're not going to pay it until you go back in, correct it, and resubmit a new claim in, eliminating that denial. If you can. Again, if the patient is not eligible, you can't correct that. If they determine that the diagnostic code does not match the service code, you can go back in and correct that part. But if the patient's not eligible, you don't have an authorization number, things like that, it's going to be very hard to fix that kind of problem unless you happen to type in the wrong ID number or something. But if you looked at the number of rejected claims percentage-wise compared to denials, since 2010, the reason for rejections have really gone down. We're less than 3% of the claims get rejected today. And that's why a lot of the revenue cycle billing companies will come back and say, our clean claim rate is 97%. That means that only 3% of the claims get rejected for whatever reason. But denials are increasing. And if you think about it from the insurance plan's point of view, their goal is not to pay the claims. Their goal is to pay legitimate claims. And if they can find ways of denying it, they will do that. Because, again, no matter what, it delays payment coming to the doctor's office. We have to really work these, figure them all out, and, of course, eliminate the denials before they actually occur.
I think that's a very salient point, and I think there is a fair amount of animosity on the part of physician practices right now towards the varying insurance companies and how reluctant they may be at times to pay out, and the kind of things that they'll do to sort of delay and or avoid. It certainly can be frustrating.
I agree. It's a big challenge. The doctors and the payers are actually battling for this money. Payers don't want to pay. Doctors want to get paid. They provide it to service. So it's a challenge, but we really talk about what are some of the reasons for the denial. So that's probably a big factor.
And let's dive into that. Now, you mentioned, of course, that there's more than 350 different denial codes right now, but could you maybe touch on some of the more common ones?
Well, probably the highest percentage of denials come from patient not eligible. And that basically means this patient's not covered under my health care plan today. They may be covered after the fact, or what happens a lot of times is the patient has insurance from last year. Patient checks in, no one updates the insurance, and you end up sending the information to the wrong insurance company, or that the patient's lost their insurance. 27% of all of the denials are basically because the patient is not eligible. That's easily fixed by doing real-time eligibility checking at the time you schedule the patient and at the time the patient shows up in the office. You can do a real-time check again. What I like doing is checking eligibility right when they schedule. I want to make sure they have insurance. We also check eligibility 2 days before the appointment again, because I don't want the patient showing up on Tuesday and we find out they don't have insurance. I want to check that on Friday. Ooh, they don't have insurance? Now I can call the patient and say, do we have the wrong information? Have you updated your insurance information? I want to get that information before they show up. The hardest thing for a doctor to do is have one of their patients show up. We haven't checked eligibility, and now we've got to tell the patient either they got to pay cash or they have to go home. Most doctors will see the patient anyway, and the problem is they're not going to get paid then. We hope to get the right insurance information. A lot of times the patient just says, well, I changed it, but I didn't bring my insurance card and I thought you already had it. The more you could do proactively to check it at the time of scheduling, check it 2 days before the patient shows up, and recheck it again on the time they check in. Again, real-time eligibility checking, you pay a flat fee for that no matter how many eligibility checks you do. Do it often. So that's probably the biggest one. Another one you have out there is duplicate claims. Of course, that doesn't hurt you too much. That just means you sent the claim in. It's been 30 days. You haven't heard anything. And for whatever reason, their billing office resends it in again. It comes back rejected as a duplicate claim. Those are things that's okay because you don't want to have to deal with, sending 2 different claims in all the time. But it takes time. You've resubmitted it. You now have to handle that. You're better off making sure that you don't have duplicate claims. But again, that's one of the ones that are kind of high up there. The other one, as I mentioned, is not matching the CPT codes up with the ICD-10 codes. That should all be caught inside your EHR product. The EHR product should be sophisticated enough that says, this diagnostic code does not match what you did. Somebody comes in because they hurt their toe and you do an x-ray of their right elbow. They're not going to pay for that. Somebody comes in for whatever medical reason. I've got a stomach ache, and you're ordering certain type of tests for that has nothing to do with the stomach. They're not going to pay. There are common LMRP rules and CCI edit rules that should be built inside your EHR product that catch all those things, so it always matches. But if the EHR doesn't catch it, your practice management system should automatically catch it. And that's what we see with some of the more sophisticated products out there and the vendors who are doing the billing. They know what to look for, and they catch these things, and it basically eliminates that denial. Timely filing is a big issue. I'm not sure why practices have a problem with timely filing anymore. You see the patient today, the claim should go out tomorrow. When we're all paper-based, yeah, we can see things taking a while. But too many times I see doctors making rounds in the hospital, and we don't get the information to maybe 30 or 40 days later. Doctor does surgery, and no one follows up on it. We're really good at following up on the office visit. We see a lot of times the practices are missing timely filing on things that occur outside of the practice, things where they have to get the data from somebody else. Another one is services not covered. The practice really doesn't know what the insurance plan covers for that patient. We don't do a complete evaluation of everything that's yes and no type covered. But again, a lot of the services can be rejected because the service is not, or what's happened a lot of times, out of network. Patient comes to see the doctor's not within that network. The insurance plan has the option of denying that claim because you're not within network. You need to know which patients you can see, which ones you can't see. And again, the eligibility checking catches that a lot. I've also seen a lot of practices that are still on outdated codes. Remember, the codes change every year. They add some, they delete some. I've had a number of practices where we have outdated CPT codes, outdated, of course, ICD-9, now the ICD-10 codes, but even those are being changed. If you submit the wrong code, they can reject the entire claim as being denied. They'll receive it, they'll accept it, but they'll deny it because one code is wrong. Things that you should be able to eliminate by making sure all of your coding is up to date all the time. Modifiers are always an issue out there. Do you put a modifier or do you not put it in? Again, the EHR should catch that. Your practice management system should catch that. But if you get a denial for not having the modifier, let's go back into the system and build that as a requirement and in the EHR or the modifier so it knows you need that modifier and it tells you which modifier you should have to have. So you don't have to keep correcting things. Let's fix it one time so they always go out correctly. And, of course, there's always certain things, insufficient information. And most of the time, those are claims that end up being pendent. I'm going to pay the claim maybe if I get additional information. Best example of that probably is patient came in, they hurt themselves over at a location, at a restaurant or someplace else or at the home. That could be a workman's comp claim. That could be a personal injury claim, or it could be I was in a car and I got hurt. That could be a auto injury claim. The insurance plans will not necessarily deny the claim, but they will pen the claim waiting to find out, prove to me this was not auto, personal injury, or workman's comp. And again, if you don't respond quickly, they'll deny the claim. But again, we need to know if this claim could be related to one of those other three categories, because remember, the medical insurance plan is not responsible for personal injury, workman's comp, or auto injury. Those are covered by other insurance plans. So again, having all that information really does help understand who the denials are and how do we eliminate denials as we go forward.
Excellent.
Next question.
When we're talking about denial management as a function, what do we really mean there? Like, what can we expect from a basic practice management or RCM service in that regard?
Well, obviously you start by you receive the denial, and nowadays almost all denials are coming back electronically. The question does the board have to post the reason for the denial in the system? What I see too many times is the claim got denied, and we said, yeah, it was denied, and we reworked it. But why was the denial there? What was the reason code? I need to know exactly what the reason code is so I can figure out how many times this occurs and we can eliminate the problem. So the claim comes in denied, the person works the denial. The challenge ends up being is they may not be documenting it correctly. I'm not putting it in the right way, but I need to know how these denials are for legitimate reasons what percentage of the denials are things that I can fix, that I can make sure it's done correctly next time. Keep coming back to the example, eligibility. If I'm getting a lot of claims coming back because that patient's not eligible, I need to change my process and my policies up front to make sure we're doing eligibility checking up front. We need to fix that at the front end. Don't try to fix it at the back end, because then it's too late after that. We also need to keep track of how much money we have to write off for denials. You have contractual allowance denials out there, but you also have denial reasons. I need to know exactly how much was written off for denials so I can see what the problem is and what is it costing me. Most doctors have no idea how much it's costing them for denials and the reason for the denial and which insurance plan is writing or denying things which cost me money. The more I know about the reason for the denial by insurance plan and the cost tells me where I need to spend my time changing policies and procedures so we can eliminate these problems, because every dollar in denial is $1 out of the physician's pocket. And again, there's a lot of stuff we can be doing around this. Another thing I want to know is how many denials came in and we did not follow up them within a timely manner. Again, nationwide, 29% of the denials are not followed up in a timely manner. I want to know how much that cost me. And again, what I typically see with a common practice management system is we don't have any of this numbers. And what ends up happening is if I have to write off $500, it gets written off as a contractual allowance. These are not contractual allowance costs. These are denial costs. And I need to know exactly why I had a denial, from what insurance plan, and what the cost is. A physician should be demanding this out of their billing company or their billing staff to know exactly what the denial reasons are. Because, again, you're providing a service and not getting paid for it, which is different from I provided a service for $300 because of contractual allowance I only got paid $100, and that's a difference, is the contractual allowance amount. This is pure lost revenue, and doctors should be demanding getting good reports on a monthly basis, how much money the practice lost because of the denials. It's a big factor, and most doctors don't ask for it.
That's a very key distinction, to be sure. So with that in mind, if we look forward to a more enhanced system of denial management, or RCM, could you contrast those common procedures with the more enhanced feature set that's available?
Yeah, the more advanced systems that are out there now, and of course the challenge always is the vendors don't tell you if they're common or advanced. You have to kind of look at the functionality. So one of the challenges of being is I want to know exactly, does that software provider provide me a tool that allows me to identify a reason for denial by insurance plan, go back in and fix the problem inside the practice management system to eliminate that denial. That's the first step of it. I want to be able to eliminate the denials before they occur. The second part is I also want to be able to go back and look back over time to see how many denials I've had by denial reason, by insurance plan, to figure out trends. What has changed over time? Because we do know the insurance plans change their rules, and we have found that every quarter, about a quarter of the insurance plan change certain things. And it's hard for the practice to stay current on all that. The billing companies are probably a little bit better on staying current, but I need to go back and look at things over time to find out how many denials I had so I can see a trend. The trend could be I had one denial last month, I got 10 this month for the same reason. There's a problem out there. I need to go in and fix it. Again, the common systems will tell you that there's a denial, but they don't go back and analyze the reason for the denials, how often they occur by insurance plan. We need that kind of information. And the goal is to identify trends so I can eliminate the reason for the denial instead of fixing one denial at a time. And again, if I do this, the practices that have these advanced systems, we have found a reduction in denials by over 40%. Now, again, you reduce the number of denials, you're saving your staff a lot of time, and that's going to mean more money in your pocket because you're eliminating these denials before they occur. So that's the advantage of these advanced systems. It's preemptive elimination of the denials.
And at the end of the day, it's money in the bank. I think that's one of the most important factors we can refer to here today at all.
Yeah, because you're saving time and saving money, and that's the advantage of having a more of this advanced denial program out there today.
So we'll take a little step back. Maybe we'll zoom out a notch, and we'll talk about the steps that we can take as physicians and office managers to help reduce the cost of denials to our business. Now, I know you've got some solid suggestions here to get us on the right track, regardless of the type of system that you currently have in place.
Yeah, and one of the things we've done, and depending on the size of the practice, of course, I mean, you may end up assigning denials to a certain biller or a certain follow-up person. In other words, you might have somebody just handling Medicare. You may have somebody handling the Medicaid/CHIP program that's out there. So it all depends on which way you want to do these things. Again, there's certain things you really should be doing. As I mentioned already, this automatic pre-eligibility checking at the time of appointment. And again, checking it 2 days before the patient shows up. This is probably the #1 reason for denials that are out there. So just doing these little steps here, having the system automatically check eligibility. And again, these are done in most of the products today automatically. You don't have to do a thing. It will automatically check it for you, and that will eliminate up to 38% of the denials just by having an automated eligibility front-end checking system for you. So that's probably the first step always to do that one. So there's other things we can also be doing too. Making sure your EHR and your practice management RCM software has automatic checking for all the coding requirements. As I mentioned, correct coding, the CCI, and local codes, the LMRP edits. Check with your vendors. Make sure that they are updating the CCI and LMRP edits on at least a quarterly basis. What I see a lot of times is a practice software vendor gives you that information when you first start and they never update it. They rely on you to figure out how to update these things. And the vendors are much better at figuring that out because they look at things across the country. A practice doesn't have time to figure out every single rule change. The vendor should be providing that as part of your software maintenance coming out. And again, with the RCM products out there, they have things called scrubbers that check for all of these things to make sure that the claim is clean and can be sent in and fully automatically adjudicated. So by having these edits in there, making sure your scrubber is the best, again, you're going to get a 98 to 99% clean claim rate going out, and it eliminates a lot of the denials that come afterwards. So one of the things you have to do, I guess, is really talk to your vendor. Find out how often they update these, or just expect you to update it. The top vendors do all the updating for you, and that's what you're looking for. If they're not updating it, you're going to get a lot more denials. And again, this is another reason 32% of the denials come from just not updating the rules within the billing system, primarily around the CCI and LMRP edits, but other kind of things too, to make sure things that they have to have within their system. Fix it first, and you eliminate the denials going forward. So just the first two eliminate almost 65% of all the denials just by doing these first two things. The next one?
Yeah, that's huge. Please feel free to continue. But that, just like you say, those first two are so dramatic an improvement that you can make, today.
Yeah. So again, as I've already said once, a couple times actually, if you do get a denial and you're still going to get them, start tracking the reason for the denial by insurance plan and looking what the cost is for that. What was the dollar amount that was rejected? Track those things over time. That's so important because, again, the basic system only says you've got 6 denials. It doesn't track it over time. And set up a policy that every single denial you get requires a response within 7 days. And again, the advanced products out there today will say you've got a denial, and you can set up in your process who it should go to and a deadline when it needs to be corrected, refiled, or if the patient's not eligible, you're going to have to write it off. But only give the staff a maximum of 7 days to handle that claim. That can be a policy. You can build that into the workflow, that the system automatically pops up and says, hey, it's been 5 days. You only got 2 more days to follow this up. And as a manager, office manager, I want to know what percentage of the denials were not handled in 7 days. Remember, you've got more than 7 days to handle it. But I want to know that if I got a denial in, I want 80 or 90% of those handled within the first 7 days. Even if you have 30 days, don't wait. Because what ends up happening if you wait, they get lost in the mix and you don't get them corrected and fixed right away. So again, fix the reason for the denials, don't fix the individual denial. And really monitor and track that over time. Because again, it should be a very small percentage. You should be able to get that down to less than 1% of your claims get denied if you have a very good system for doing this. Again, just by eliminating the eligibility and the claims for coding, you can eliminate 70% of them. Let's get it down to 1%. That should be your goal. 1% or less claims being denied by the insurance plan. That's got to be the goal.
Well, that's a lot to think about for sure. I'd like to just remind everyone really quick that indeed the slide deck will be included in the webinar follow-up, so you can reference these tips again in the future. But in a more immediate sense, Mark, let's talk about a few next steps for our audience to take. So where do we go from here?
Well, one of the things I always call key performance indicators, and a lot of the vendors will have certain things about that. You know, what's your revenue this month? What was your contractual allowances? But start creating key performance indicators around the denial. Because again, every dollar denial is money lost out of your pocket. So create key performance indicators like what we talked about. How many denials, by insurance plan, by denial reason, and the dollar amount. Your practice management software vendor should be providing you a complete suite of information about the denial. If they're not, talk to them about it. And there are some add-on products that are out there you can actually add to it to actually have a denial management program if your product doesn't do it. But don't sit back and wait. Denials cost you money. Create a program where you can look at it on a monthly basis. What's it costing you for the denials? And if you don't have an enhanced denial management program, go out and get one. You can talk to the vendors, find out what they're doing, talk to them about what are they doing to help you eliminate denials. And if they don't have a good, clear reason, there are other vendors that a lot of these practice management vendors work with. Or you may want to consider outsourcing your billing to somebody else who specializes in billing, collection, and advanced denial management firms that are out there today. Because again, if you have automatic eligibility and prior authorization checked, if you have a clean claim rate above 99%, you're checking for the CCI and LMRP edits that are out there. You're doing advanced claim scrubbing. If you're doing all of these kind of things, your denials will be less than 1%. And I've got, of the 60 practices I'm working with right now, I've got 52 of them that are under 1% of their denials now. But of course, that took a lot of work to figure out what the problems were. It didn't happen overnight. But by analyzing the reason for the denials, figuring it out, and fixing it up front, the software is advanced today. It can catch these things and fix it for you. So don't just find a denial and fix it. Fix the reason for the denials so they don't occur going forward. That's my kind of ending kind of statement always.
Yeah, it feels like something that can't be said enough, really. That, you know, to really just to be fixing it and be on top of that is about as proactive as you can get to really, you know, figure out what's going on now and how to fix it for the future.
Yeah, and get practices, spend their time fixing one denial at a time. They don't eliminate the reason for the denial, and that's what you got to look at. That's the biggest difference between common and advanced. The advanced fixes the problem at the core, so it eliminates the denials going forward.
Mark, let me just thank you so much once again for this presentation. Really quite a wealth of information covered here, and it's truly invaluable. We're going to move forward here, open up the poll, and go ahead and transition into the question and answer portion. Just as a reminder, if you are watching WebEx in a windowed mode, on the right side there's a Q&A box where you can type in a question and hit send. If you don't see it, click on the Q&A icon on the top right to make it appear. And similarly, if you are in full screen mode, there is a Q&A button within the controls at the top of your screen. Please do stay with us just after the Q&A for a very brief presentation from Care360 about our complete suite of healthcare IT solutions that are designed to increase the efficiency of your practice. Mark, we do have a couple of questions that have already come in. I'm going to start with this one, set you right up with it. But It seems like a lot of our denials are the result of the incorrect information we receive from the payer when we verify benefits. Are there any specific ways to help prevent that?
That's a tough one because in that case, you're receiving information from the insurance company saying these are the benefits of this patient. And they're basically telling you that's what's going to be covered. Therefore, there shouldn't be denial of that. But that's where you have to be able to go back, do the eligibility check, get the benefits electronically sent to you through that eligibility check that says, as of today, these are the benefits. You can then use that as part of the appeal process to say, look, you sent us this eligibility. You said they were eligible for these services. We should get paid for it. So that's why it's important to do the eligibility check up front, get that documented information that says what's covered, and use that as part of the appeal to get the denial taken care of. Because we do see that a lot of times, oh, the insurance plan just made a mistake. Yeah, did they make a mistake on purpose to help eliminate some of these payments? How many doctors really trust the healthcare plans? Not that many, but if you do it correctly, you keep the information, you can help eliminate a lot of these denials.
I have one here that may be a bit of a pipe dream question, but I'll throw it at you anyway. Are there any free programs that offer an enhanced denial management program, at least that you're aware of?
Yeah, nothing free. I mean, realistically, your current practice management software vendor should be providing enhanced denial management that tracks denials over time and allows you to go back in and fix the reason for the denial and have it update all the claims that got rejected for that. So I would be demanding that out of my system. I mean, I look at the top 10 or 15 practice management vendors. They all have that built in today. So you should not have to add anything on. It should be part of it. If you're using a billing service, I would definitely ask them about, this what I call advanced denial management. It's really about, I want to know how many denials I had by month, by reason, by insurance plan, and what the cost is for that. If they cannot provide that for you, I would be demanding it because we classify that as a minimum requirement going forward. It affects my revenue, it affects the billing company revenue, and it's really good if it affects the doctor's revenue, it's going to affect the staff's salaries. Because if I have to write off 10, 15, 20% of the work I did because of denials, I want my staff to fix those problems because that's going to affect their salaries. So if I don't have money coming in, I can't pay them. And there is no reason you cannot reduce the amount of money you're losing on denials from 10, 15% down to 1%. So it may not be free out there, but your vendor you're working with today should be able to provide that. If they don't, you have to say you should be thinking about looking for a new vendor in the near future because denial management is the highest cost for any organization today.
I think that makes a lot of sense. I think we can all agree that, even just taking a look at our current resources and maybe asking the bigger questions of them, with this knowledge is the next step for sure. Another question that came in here, Mark. We have a lot of frustration in our office with the insurance companies, and there's sometimes excessive requests for patient info and medical records that seem wildly inconsistent from one company to another. Is there a standard in place here, and is it something that an enhanced RCM can better assist with?
It depends on what they're asking for. In most cases, the insurance plans are asking for additional medical information. For example, you saw the patient in the emergency room. They want to see the emergency room report. You did a lab test. They want to see the results of the lab test. In most cases, they're not asking for additional billing software information because that should come out in the HCFA 1500 form, but they will be asking for more clinical. And there is no standard today. Once we get to a point, and the funny part, this was part of the 2009 HIPAA regulation, was to create a standard format for sending medical information back to the insurance companies for when they need additional information. It should be as simple as the insurance company says, I need to see the lab result. You go into that EHR product, you find the patient, you click on that lab result, you hit one button and automatically sent to them. Most of the EHR vendors never built all those interfaces. They expect you to go find it, print it out, fax it to the insurance plans, because that's the easier way for the EHR companies to do it. We need to get to the point where it is so simple for me, based on the request, to click on it, automatically create a cover letter on it, and send it right back to the insurance company through a secure internet connection. Much better than printing it out, faxing it over. But that's how most people are doing it today. They're faxing it over. Of course, faxes are not very secure. That's one of the problems. I mean, the fax could go to the wrong place. It's not a secured line necessarily. But things that we can fix on that. So I think there is no standard out there today. But first, we have a couple practices that we know that the insurance company always asks for certain things. Every single claim that goes out. So now what we're doing is when we send the claim out, we're also sending out the additional information that they wanted. Example would be, it's a workman's comp injury, it's an auto injury, it's a personal injury. We already know they're going to ask for additional information. We build that into our process so it automatically sends the claim out, and then later on, usually within the next 10, 15 minutes, it automatically sends the required clinical part of the chart that they need. So we don't have to wait for them to hold on to it for 30 days, then request the information from us, and then we have to send it back. It basically eliminates that timeline delay on getting claims paid because the insurance plan is waiting for additional information. So again, we can automate it, but we got to find out what the issue is, figure it out, find trends, and if the insurance company asks for that information often, get it to them ahead of time. Don't wait for them for it.
Excellent. Mark, let me thank you once again for your time and your expertise here today. Mark's contact info and resources will be included as part of the follow-up documents that you receive after the presentation, and they're on the screen now. So you're welcome to pester him offline with more questions, right, Mark?
That's true. Anytime they want to call, let me know.
All right, sounds good. Turn our attention to our sponsor, Care360. Care360 offers a complete end-to-end solution for all of your practice needs. We focus on the business side of things so that you can focus on your patients. We connect all manner of healthcare organizations, physicians, and patients to improve access to information and insights. You may already be familiar with Quest Diagnostics labs and diagnostic services, and many of you are currently enjoying our award-winning EHR. But our integrated approach to healthcare IT can cover your needs throughout the entire patient lifecycle. And because we're backed by Quest Diagnostics, you know that you can rely on a stable and proven partner. Our network is strong, connecting over 450,000 physicians and touching the lives of over a third of all Americans every year. The confidence and reliability that comes standard with every Quest Diagnostics Care360 relationship is easy to appreciate and to benefit from. Our holistic suite covers every aspect of your patient and practice lifecycle, from appointments and reminders, documenting a patient visit, verifying insurance and processing payments, and right through integrated follow-ups via our MyQuest patient portal. If you're looking for a complete solution from a single source, Care360 has you covered. Our electronic health record is an ONC certified, award-winning product that works extremely well with small practices like yours. It's cloud-based with powerful mobile integration to your smartphone or iPad, allowing you to work wherever and whenever it's most convenient to you. The practice management side allows your front office to work more efficiently, to manage the flow of patients, keeping your practice organized and agile, linking directly to your EHR so that you can spend more time focusing on your patient and billable encounters instead of front office administration. If you're considering an enhanced medical billing service, Care360 has an outstanding revenue cycle management solution for you. Few things are as time-consuming for your practice and staff as billing and collections. Handing off the more monotonous busy work can free your staff to focus on patients instead of on spreadsheets and denial management. Trust Care360 to provide you with a solution that's up to date on the evolving trends and the changes in the industry. If you have more questions about Care360, please feel free to call or email using the contact information on the screen. And once again, we thank you all for your attendance today. And a special thanks to Mark Anderson and, of course, Care360 for sponsoring the event. Keep an eye on your email inbox for additional presentations covering related issues in the near future. This will conclude today's presentation.
Healthier outcomes are now easier to embrace. We know you run a busy practice, and efficiency is top of mind. Discover 360 degrees of connection and support. Keep your practice on solid ground with a cloud-based EHR.
Care360 offers a full and fully mobile EHR that helps keep medical practices efficient and profitable,
while connecting to the larger healthcare community.
Join the network of over 300,000 Care360 providers in 90,000 locations and connect to other healthcare providers as well.
Coordinate care to and from anywhere.
Care360 integrates providers and technologies across sites and care settings,
while seeing and sharing the bigger picture.
Care360 allows you to send patient information using the CCDA industry standard format, accept information from other providers, and access extensive patient lab histories to help optimize care.
Meet meaningful use requirements.
Care360 EHR is ONC certified to qualify for meaningful use,
while exchanging data simply and securely.
Physicians collect and share data with other EHR users to meet industry requirements with Care360 Data Exchange.
And with new Care360 Revenue Cycle Management, you can maximize collections and revenue.
Care360 provides you with a team of billing experts to take complicated billing issues off your plate, allowing you to focus on what matters most, your patients,
while reducing your administrative burden. And that means more time with patients. Care360 also offers many other great advantages. Boost patient engagement and compliance with MyQuest.
Patients can view and share vital health information with their healthcare providers.
Elevate patient conversations with interactive insights.
Enhance lab results with diagnostic insights, accessible in Care360 and to patients through the MyQuest patient portal.
That's 360 degrees of connection and support, and healthier outcomes for all. Care360.